then no.
What is the what there?
This one.
Extension? You want a 220 extension?
Yeah. Lamp. Virgin on the side.
Yeah, but I want to kind of put a lamp to that root over here. That root for all this. See this one, you want extension and a little root. You have this?
So where do you open up one time?
Yes.
I want to formally welcome us all here for the handover ceremony of a donation from the Republic of China, Taiwan, to the Ministry of Health, Wellness and Environment today. We do have an agenda, which I know you will not have with you. But just to let you know that I will serve as the chair today, Cuthbert Knight's Permanent Secretary in the Ministry. Then I will have a word of prayer. I'll make a few welcome remarks. Then we will have our project coordinator to give just some brief remarks on this project, very brief. And our project manager will give just some brief on the vehicle, its features, etc. And then we will have our distinguished ambassador to bring us some remarks as well, and then our own Minister of Health, Wellness and Environment, Honorable Robert Brown, to bring us the featured remarks. The Honorable Minister of Health, Wellness and Environment, Mr. Robert T.L.V. Brown, His Excellency, Mr. Calvin Hou, Ambassador of the Republic of China, Taiwan, distinguished James, Chief, ICDF, Helen, all of your team members, senior members within the Ministry of Health, Wellness and Environment, friends, well-wishers. Again, I wish to formally welcome you here today. And as I said before, we are marking the handover of that vehicle behind you, which you can see there. And the vehicle is being handed over to us today by the distinguished ambassador, and he will hand the vehicle over to us, the Ministry of Health, Wellness and the Environment. I want to say to you that this is a very important moment for us. We have a piece of equipment, a machine, a vehicle, which is going to help us tremendously with our public education in terms of educating and sensitizing the public on various aspects of health or health promotion. We are very pleased to have this, and because of our very good cordial relationship with the people and government of Taiwan, Republic of China and Taiwan, we were able to benefit in terms of this vehicle. This is not the only benefits we have derived, but we're here today for this purpose. Once again, I'm very happy that we are all here. It's a very symbolic moment, and again, I formally welcome you. And so as not to delay us or detain us further here, I will therefore now ask for our project coordinator, Dr. Del Hamilton. She wears many hats here in the ministry, coordinator of NCD, project coordinator of this project, and many more. So I'm going to ask her please just to give us very brief remarks on this project.
Alright, good afternoon everyone, and I'd just like to adopt the protocol that has been established, and just like to say how very pleased I am as a member of the entire project team, as the project coordinator, that we have been able to reach to this important milestone. This project, which is called the Capacity Building Project for the Prevention and Control of Diabetes in St. Vincent and the Grenadines, is a 3-year project where we have been implementing a number of activities. In another few weeks, we will be having the launch of our national campaign, which we are calling the Hearts Movement. So in another few weeks, we'll be having the launch of the national campaign called the Hearts Movement. And as part of that launch, we have some sub-themes. The Vinci Moves, where we're going to be encouraging our Vincentian population to move more. Vinci Foods, where we are going to be trying to get people to eat more fruits and vegetables and practice living healthy by eating, decreasing the salt content, sugar content, and so forth. And also the Vinci Grooves, which is an area that we tend to neglect, that spiritual, emotional, and social side of who we are as a person. And we'll be also looking at dealing with depression, anxiety, and so forth. So it's going to be a comprehensive campaign. And everyone knows that right now, coronavirus has been declared a pandemic. And so everyone is on high alert, trying to protect themselves from becoming infected. And I think it's a good time to let persons know that with respect to the risk of dying, persons living with these chronic conditions, diabetes, hypertension, cardiovascular diseases, are the ones who are dying more. So it's important even at this point for us to try and get our blood sugar under control, our blood pressure under control, because we see that this virus is affecting our system in such a way that if you have one of those conditions, you are more likely to die, as well as if you are among the older age group. So we see the importance even with this infectious disease, how important it is to control diabetes and hypertension, cardiovascular diseases. So I am sure you would appreciate how important the mobile outreach unit is going to be in terms of helping us to get our people more active, eating healthy, and controlling their conditions. So once again, I'd like to thank you for being here, and I'd like to thank the Republic of China on Taiwan for the generous donation, and more is yet to come under this project, and we're grateful. Thank you.
Thank you very much, Dr. Hamilton, and we do appreciate the thorough overview of where we are at this point with respect to this project. We're going to ask our very own project manager, Mr. Fan, to just come and brief us on the vehicle, specifically detailing what are some of the features of this vehicle.
Thank you, sir. I am project manager. My name is Chen Hua Fan. Right, so after 2 years, we finally got the mobile outreach unit. It's a customized vehicle and it's a stage vehicle. So the main purpose we are going to have this vehicle is for the we can drive this vehicle to the community. We deliver the health information to the community in front of their face instead of sitting in the hospital waiting for the client coming. We outreach the community people, right? So that's the main purpose. We are going to deliver those health information to all the community people. Right. Thank you.
Thank you very much, Mr. Fan. We do appreciate that so much. And we are going to ask the ambassador, who is no stranger to us, and as Dr. Hamilton said, we are most gracious for this generosity, for this vehicle, which is really going to add significantly to our work here in terms of our healthcare delivery. So without much ado, I will ask the Ambassador Calvin Chow, to come and bring some brief remarks for us.
Thank you very much. Honorable Luke Brown, Minister of Health, Wellness and Environment, Permanent Secretary Mr. Albert Knight, and two coordinators, Dr. Hamilton, Mr. Fan, and senior officials from the ministry, and my colleagues from both the embassy and also the technical mission. And probably we have some media friends here. And ladies and gentlemen, very pleasant good afternoon. I'm very, very glad to attend this handing over ceremony. This is, to me, it's another big step for this current public health project. Not long ago, I was in the Ministry of Health, Ministry of Agriculture, for the handing over ceremony of some fertilizer. That's a very important step for the local banana farmers. And today we are here. It's also a very important step for this public health project. We have some introduction from both coordinators about these vehicles. This vehicle is it's not easy to get it because it's come from Thailand, and it needs to work to make it work function well. And with this vehicle, this mobile health promotions vehicle, this project, the service of this project can be more mobile, more accessible, more reach out to the local people who are in need. And so this will make this project more beneficial to the people who are in need. So I think this is a very, very important step. You all know that our two governments are actually collaborating three important projects in public health, in agriculture, and also in ICT. Three of them are very important for your country, for local people. But nowadays, especially today, when we look at them, I would say this public health project become even, attract more attention, because as PS just said that, our coordinator just said that, we just have confirmed a coronavirus case here, and the duty of all the governments, one of the duty actually to safeguard the health of their nationals. That's the same goal that the WHO are pursuing. So the important part of our work is to provide our civilian live in a healthier environment. So in this our public health project, we're focusing the prevention and capacity building control about diabetes, which is NCD, a non-communicable disease. But nowadays, as you are aware, it's not only NCDs, but also some communicable disease, some infectious disease also that will influence our health and in a very rapid way, just like coronavirus. And coronavirus actually is not the first case. We had SARS in year 2003. So all of this showed that it's very, very important for our both government to work together to cope with this kind of NCDs or also infectious disease. So it made me feel more meaningful to devote our personnel to work together with our essential colleagues in this field. And I also like to take this opportunity to extend my gratitude to Minister Brown, also to the government of St. Vincent and the Grenadines for their past and continuous support for our participation in WHO. And as I said, this the outbreak of the coronavirus or some other infectious disease like flu or like even diabetes, this kind of health issues actually is something that we need to do together and prevent it and make people live in a healthier world. So that we need to work together. So in this case, I look forward that all of you, include Mr. Brown, the government, and all of you can extend more support to us for our bid to WHO. We believe that our experience can be useful not only to our true friend here, but also to the world community who are in need. Because we always have an old saying that individually work, you can function to some extent. Work together is become a multiple function to a larger scope. So thank you very much for your attending. This vehicle is very, very beautiful, and I believe in the future, just like from time to time I saw, some school bus carry out our two flags running on the way, sending school children here and there. Every time I saw the bus like this, I feel very proud that we can work together to do something for local community. And in the future, I believe I will see this vehicle run here and there and benefit our people, local people who are in need. So thank you very much. Have a good day.
Thank you very much, and I think we can do better than that. Just to put it in a little frame for you as to what we are doing today, we are, along with the Republic of China and Taiwan, are executing a project called Project for the Prevention and Control of Diabetes, and this is a capacity building project. So this vehicle is just one aspect of that project. So this vehicle will be helping us to do our community outreach, our community education, our health promotion activities under this project. Now we've gotten to the stage where we will invite our minister, the Honorable Minister Brown, who is working very hard, very assiduously. I said to you that we left the ministry last night really about close to midnight, and he was back here this morning. Normally he's here by 6 o'clock. He's here before me. So he works very hard. And the moment he heard we had this vehicle, he said, listen, we have to be able to have this vehicle handed over, have the joint, we need to put this vehicle to use. Project is going well. We want to see the vehicle being in action. He was adamant, we are going to do it today, and we are here today. Thank you, Minister Brown. So we now invite our own minister to come and give us a feature remarks.
Thank you for your kind words, PS. Good afternoon, everyone. I know from a poll that I did a while ago that everybody prefers to be here than to be having lunch right now. And I just want to let you all in on a secret. When this vehicle came outside the ministry yesterday, we had several drivers from the ministry around, and there was a competition among them to see who would be the driver for the vehicle. I don't know if anyone won that competition yet, but it's very stiff. So you could see, even from the excitement and the exuberance of our drivers, that they recognize that we are onto something good with this handover. Now, I'd just like you to give a special round of applause to the ambassador and his team from the Republic of China and Taiwan. You recognize that we are standing side by side today. But it wasn't meant for all the Taiwanese to be on one side while the rest of us are on the other side. Because there ought to be a perfect mixing. But we stand side by side, as is reflected by the fact that our flags are also side by side here. So this is really a joint event between Taiwan and St. Vincent and the Grenadines. And we've been standing side by side in one way or the other since 1981, when diplomatic relations were established between our respective countries. And long may this continue. You know, and at this moment, at this event, being an event that is organized or that was organized jointly between us, I think it is appropriate for us to acknowledge the competent response that has been demonstrated by Taiwan in relation to this novel coronavirus. Could you imagine that 80 miles away from Taiwan or thereabouts lies mainland China? And in mainland China, there are almost 100,000 cases of coronavirus, this novel coronavirus. And Taiwan right nearby, which is closer to mainland China than St. Vincent and the Grenadines, is to Barbados, only has 49 cases to date. So in one place, you have the epicenter of the outbreak, and a mere 81 or so miles away, you have Taiwan demonstrating utter competence in dealing with this. And this is another reason why we're happy to have Taiwan as our friend. I sent a letter earlier this week to the ambassador and said to him that we would like to learn from the experience of Taiwan. We would like to explore possibilities for us to have technical assistance from Taiwan in dealing with coronavirus. And this is all the more real and all the more necessary in this situation where we have actually recorded our first case. So we are happy that the possibility of this collaboration, and in addition to the letter which was sent, we've subsequently discussed some ideas. He has given me some insight on what Taiwan has been doing, and we will be guided. Of course, as in all things, we must tailor it to the specific circumstances of St. Vincent and the Grenadines. Now, and talking about cooperation between our two countries, we gathered here as a result of a cooperation project. We gathered here because there exists a capacity building project for the prevention and control of diabetes. And this is a substantial project. Project funding to the tune of $5 million. So many things are done under this project. Persons from St. Vincent and the Grenadines went to Taiwan for training. Doctors, nurses, health promotion officers, other representatives of the ministry benefited from training in Taiwan. And they came back here with that expertise to feed into this project. We now have a situation where there's this handing over ceremony today for this specialized vehicle that the drivers are competing to use, and which would help us tremendously, immensely with our outreach activities. Help us to take the message of prevention and control of diabetes into our communities. And diabetes and non-communicable diseases more broadly is not a problem that we should consider to be trivial. It's not something that we could take for granted. The last census, with its report published in 2012, indicated that almost 8,000 Vincentians had diabetes. It was second as a problem, and that's almost, well, I think it was about 7% of our population. That is second only to hypertension as the most prevalent non-communicable disease in St. Vincent and the Grenadines. And the statistics for hypertension, I think there were over 10,000 people who had hypertension. A compounding factor is that several persons have both diabetes and hypertension. You have sugar and salt, as they say in the common parlance, reducing it to the basic elements. But we know that there are very simple ways in which you could deal with issues like this. We know that there are 4 risk factors, for instance, that you should address if you want to keep the problem under control. Those risk factors have to do with exercise. We want people to exercise more. It has to do with diet. It has to do with avoiding the consumption of alcohol, and it has to do with also avoiding the use of tobacco products. So we decided that in the ministry, we're not just going to sit in our offices and wish that diabetes should go away and wish that hypertension should go away. No, we are going into the highways and byways. And St. Vincent, as a result of this specific project, is gaining an international reputation. For the first time in May 2019, when you heard the ambassador speak about how St. Vincent and the Grenadines has been advocated for Taiwan at the World Health Assembly, and their competence in respect to coronavirus tells us all the more reason that Taiwan should be at the table, and tells us that Taiwan could help the international community. So you heard the ambassador about what we could do, talk about what we do at the World Health Assembly in terms of advocacy at filling the gap which exists because of their exclusion. But what he did not go into mentioning is that this last year, in May 2019, for the first time ever, St. Vincent and the Grenadines hosted what is called a side event at the World Health Assembly. And what did we present to the entire world at that side event? What we are doing under this particular project in St. Vincent and the Grenadines, and how it is connected to what PAHO and the World Health Organization is talking about. They're saying to us that we need to invest in health in the communities, and we've invested in health in the communities in many ways, including by setting up the polyclinics. You have some fancy new polyclinics at Bocamet. You have a new polyclinic at Levi Latham, and we have the Stubbs Polyclinic to complete our complement of polyclinics. So we have to invest in the communities. We did that by increasing dramatically the number of staff in the communities, the nurses and doctors in the communities. We also did that under this project by ensuring that there's basic equipment at some of these facilities so that testing could be done, so that persons could know their status. And as a result of knowing their status, interventions could be made to improve the general condition of health of persons. And investing in communities is consistent with what is required to make sure we make a dent against this problem. Because when someone has to get to the doctor, or when someone has to be hospitalized for NCD or NCD related matter, they are already far gone. If we do things now to prevent you from getting to that stage, it is going to be more cost efficient, and it would be better for your overall health outcomes. So St. Vincent and the Grenadines, while it is doing its work in relation to the coronavirus, and we're taking all precautions, and we have a very active program upcoming to deal with that, continues to take care of some of its other essential business, including what work has to be done in order for us to effectively resist non-communicable diseases. So we are working on infectious diseases in one hand, and we are working on non-communicable diseases on the other hand, and one central feature to both our work in respect of infectious diseases and non-communicable diseases is the Republic of China on Taiwan. We have a remarkable vehicle here. The cost of bringing it to St. Vincent is of the order of $100,000 US, or 250,000 plus Eastern Caribbean dollars. That does not include duty. That does not include some of the extra items that will be put in. So when all is said and done, we have something here that is valued upwards of $400,000, perhaps close to $500,000, being placed at our disposal so that we could improve and strengthen the healthcare system of St. Vincent and the Grenadines. This is a beautiful development which would have positive implications for our ability to carry out our work throughout the length and breadth of this country. And I look forward to it not just being on display here, but being in our communities and making a difference. Thank you very much.
Thank you so much, Minister Brown. Always brings to us remarks, speech of great eloquence and food for much thought, much on which we can deliberate on. So we want to thank our Minister once more. I just want to briefly remind you that, as Minister Brown said, this is indeed a remarkable project. And you would have given the statistics, and you can appreciate, as he said, diabetes is not something which is light. And we are responding and responding in a positive way. We have seen under this project various pieces of equipment which are placed in some of our health facilities. The fundus view camera that can help in terms of problems that diabetics may have and others, specifically looking at the back of the eye. We have had equipment which can help with our foot health practitioners to look at diabetic soles, etc. We have this lovely vehicle that can help us in our mass campaign. We have also had the building of capacity training in Taiwan, and we have had 3 or so cohorts, maybe totaling to about almost 30 persons, I'm not quite sure. We will be conducting, or we're in the process of conducting a study, and we'll be having an international conference this year, which will somehow detail some of the results of this study. So this project is really making its mark, and we want to be very upfront with it with you, and we want to also express our gratitude again to the Republic of China and Taiwan for its generosity in making this project possible. We have gotten to the stage where I'm going to say thank you. Minister Brown, we want to thank you very much for bringing us the featured remarks and for taking time out of this schedule, given the challenge we now have with this one case of corona, which we are managing effectively and ensuring the health of our people are also safeguarded. Ambassador, we want to thank you very much. My very good friend and colleague, Excellency James, and all of the members from the Embassy of Taiwan, we want to thank you very much for being here. The senior members within the Ministry of Health, Senior Assistant Secretaries, our Deputy Health Planner, our former Chief, Mr. Doyle. We want to thank all of you. We also want to thank ITSD and their media team for being here. All of the persons from the media, we want to thank you as well. Well-wishers, and all of us who are here. We want to thank you very much for turning out here today. And you will see very soon this vehicle will be in action up and down the villages, communities of St. Vincent and the Grenadines. But when you see it next, it will be beautifully adorned with all the decals or the graphics on it. So it will be very difficult for you to recognize what it is and what it's about. Once again, thank you very much, and may God bless us all.
Consequences of diabetes, and they are all undesirable. So make sure the next time you wanted to eat some unhealthy food, just keep this in mind.
Keep this in mind.
So what we have basically is a vehicle that is not just a vehicle. We have these graphics. I think if we bring this to our homes, and when our children want to have the usual soda, we tell them, well, you know, this is what's going to happen. they might change their mind.
There's a very good, you see, the toast it shows that when you eat, you can see the less greasy food. That is true. See that?
Oh, by the way, there's a nice poster.
Oh yeah, that's
on the wall there too.
All right. Thank you.
This is what we call a ministry on the move.
Yeah.
Properly. We're not stationary. We're not static. We're taking the message.
We on the move. We on the go.
Yes, sir. Communicable diseases in St. Vincent and the Grenadines. Watch what you eat. Exercise all the time. Avoid consuming too much alcohol. And also try to avoid the use of tobacco products. Calling one and all, the ministry's message is clear. We are on the move in the highways and byways. And riding with me today is none other than the ambassador of the Republic of China on Taiwan, His Excellency Calvin Ho. And he is seated beside me, and he is literally my riding partner. Thank you.